Today we'll discuss about pharmacy officer previous year question paper अर्थात आरोग्य विभाग औषध निर्माण अधिकारी ह्या एक्झामचा क्वेश्चन पेपर. So pharmacy officer, first of all syllabus. In that syllabus, Marathi grammar, English grammar, general knowledge, and mathematics. This is a non-technical part. As well as pharmacy knowledge. This is the syllabus. So first, this is the non-technical part. So this type of questions will ask in examination. So first, पाहता पाहता शेवटी उजाडले या वाक्यातील उजाडले हे क्रियापदाचे कोणत्या प्रकारातील आहे? सेकंड, तिळपापड होणे या वाक्यप्रचारातील समानार्थी वाक्यप्रचार ओळखा. याच पेपरमधला आपण फार्मसीचा क्वेश्चन्स कसे विचारले आहेत ते बघू. तो फर्स्ट क्वेश्चन आहे फार्मसीमधला की हार्टमॅन सोल्युशन इज ए सोडियम लॅक्टेट इंजेक्शन, बी कंपाउंड सोडियम लॅक्टेट सोल्युशन, सी अमोनियम क्लोराइड इंजेक्शन and D none of the above. So answer is compound sodium lactate solution. Second विचारला होता which one of this is a radioactive compound? Barium chloride, option B barium phosphate, option C barium sulfate, option D none of the above. So barium sulfate is a radioactive compound. Third, quinidine act as an anti-arrhythmic drug. Which of the mechanism? Quinidine, which of the categories? Calcium channel blockade, beta receptor blockade, sodium channel blockade. So quinidine, sodium channel blockade. Quinidine is an antiarrhythmic drug. Next question of the centrally acting antihypertensive drugs. Antihypertensive means those drugs which treat the hypertension. Centrally acting. Okay, guanethidine, propranolol also antihypertensive, but this is a beta blocker. Prazosin is also antihypertensive, but this is a alpha blocker. So question asks that is centrally acting antihypertensive. So answer is alpha methyl dopa is the correct answer. Centrally acting antihypertensive drugs. Next, antithyroid drug decrease the synthesis of thyroxine. Which of these following? Decreasing the availability of amino acid, interfacing with incorporation of iodine into thyroglobulin, destroying the cell in thyroid glands. So answer is all of these. Next, therapeutic index. Therapeutic index is the ratio of toxic dose and therapeutic dose. Therapeutic dose versus percent response, toxic dose versus percent response, none of the above. So therapeutic ratio is the index of, or it is the ratio of effective dose and toxic dose. LD 50 and ED 50. Lethal dose and effective dose. So answer correct is that is toxic dose and therapeutic dose. Next, transport of drug against concentration of gradient take place. Active transport, B passive transport, filtration and all of the above. Next, oral anticoagulant act by antagonize the action of. Oral anticoagulant. Coagulant means anticoagulant means prevent the coagulations. So warfarin is a oral anticoagulant drugs. So simultaneous administration of two drugs. Vitamin K also anticoagulant. So both. So that's anticoagulant vitamin K. Next, pyridoxine is administered with isoniazid to minimize neurotoxicity. Next, phocomelia induced by thalidomide by shortening of limb, upper or lower limb. This is the correct answer. Schedule P is related to. This is the part of pharmaceutical jurisprudence, upper part that is pharmacology. Next, pharmaceutical jurisprudence. So schedule P is a life period of drug. This is the correct answer. Ophthalmic preparation, schedule, toilet preparation, not vaccines also, not. So correct answer that is life period of drug in month, schedule P. Example of schedule C drug. Schedule C, biological drugs, that is sera. So this is the correct answer, sera. Next, license of manufacturing of drugs are issued by Director of Industries, Health and Ministry, Government of India, Drug Inspector of the area. No. So correct answer that is State Drug Licensing Authority. Next, government of opium factories located on. Where? Gazipur. Correct answer. Lucknow, Kolkata, Izadnagar. There is no. So government opium factory is located Gazipur. This is the correct answer. Next, alcoholic preparation can be stored warehouse for maximum period of 3 years. Next, coding of atoms help in. So identifying the drug material, coding, handling or store of the atoms. That is correct. So in store there is various code is given to identify or easy to handling. This is the correct answer. Economic order quantity EOQ aims at minimizing. So EOQ is a main aim to that is ordering cost reduce. ABC analysis is based on consumption value and always better control. Consumption value. So ABC is always better control method. Next, calamine. What contain calamines? Calamine, zinc oxide and zinc stearate. B. Zinc oxide with small proportion of ferric oxide. So this is the correct answer, B. Next, the hormone released from neuro hypothesis are oxidation and ADH. Next, function of central drug laboratories to analyze sample of drug or cosmetics, to issue loan license, to issue prepacking license, to issue manufacturing license. Correct answer that is to analyze the sample of drug or cosmetics. So this is the correct answer. Next, drug which is indicated for patient at risk of Ray's syndrome. So Ray's syndrome, that is the side effect, aspirin. Next, which of the following insulin preparation has longest duration of action? Protamine, zinc. Next, antimicrobial action of penicillin due to its effect, cell wall synthesis inhibitor. Next, antileprotic action of dapsone is due to the mainly effect on inhibition of folate synthesis. Next, in pharmaceutics questions, a tablet manufacturing process mottling refers to unequal distribution of color on tablet surface. Right, this is the correct answer. Next, again pharmaceutical jurisprudence question, schedule H, drugs to be sold only on prescription of registered medical practitioner. So antibiotics, antihistaminics, vaccines and sera. Schedule H means what content? Next, histamine concentration is highest in mast cell. Next, identify the antihistaminic drugs with additional serotonin receptor block and good appetite stimulant property, that is cyproheptadine. Erythromycin antibiotics belong to which following class? Next, a drug decreases the activity of another drug is called antagonist. Agonist, one drug increases action of another drug is called agonist or synergistic. Antagonist, one drug opposes the action of another drugs. Next, chemical changes of drug living body are referred to as biotransformation or metabolism. Next, centrally acting muscle relaxant, that is mepensine. Which among the following is anti-filarial drugs? Affinity is measured, drug binding, receptor, Steven-Johnson, sulfonamide. Next, when was drug and cosmetic passed? Next, phenobarbital is, and last question, that is atropine is the ester of propane and tropic acid. So this is the all of the questions and their asked questions in previous. This is the Marathi sections. JK questions, general knowledge, math, and the last one, that is pharmacy. You have to remember this.